further aspect of sort of patient empowerment and patient access to data is actually just getting the data. For many systems, many jurisdictions, one individual's data will be held across various different domains, and that can lead to us technical challenge to connect all of that from our current, in some ways, fragmented systems. One practice that's been used in various areas around the world to deal with that is to create a person-held record, make them ultimately create their own record. In the States, in fact, providers are now legally obliged to provide that information to patients. So that pulling together of the patient data is an important part. And then I suppose the last bit about patient empowerment is the difference between data and knowledge and understanding. So they're still going to have mechanisms to allow patients to translate the data into their own personal understanding for their health. Much of that they know, they live with their conditions and long-term conditions, and they know that anyway, but we need to have the ability to provide that where it's necessary so patients can really truly get the most out of being empowered to manage their own care. I think when you look at NHS procurement or even sort of public sector procurement, obviously it's evolved through the years, and go way back, you can see how it served a great purpose. We get much more bang for our buck from well-run procurement exercises over the last couple of decades. As we move more into a digital world, a software, a technologically driven world, you can see the frailties of those sort of older procurement models, and I think governments around the globe recognise we need to develop sort of slightly different models about how we go about procurement or ongoing payment and partnership working to allow ongoing development of our systems. So yeah, it's definitely something that's worth considering where we could improve on it. So when you contemplate the differences between sort of urban, big centre healthcare processes and care versus rural healthcare processes, I think we do have to ground that in the sort of concept of realistic medicine, patient-centred medicine. There will be some practical differences. You're not going to have tertiary referral centres in the middle of islands in the middle of the ocean, so that just doesn't make sense. So there's always going to be some logistical challenges to how we do that. I think it's a great opportunity to see how we can make the best of technology and communication to enable that. So there's also a concept that there'll be one way of doing it. I think realistically there won't be one way, so we're going to horses for courses. A remote and rural area is going to maybe manage part of a pathway differently from another part of an urban centre. As I say, the way to ground that for me would be in the sort of realistic medicine and the patient-centred approach. The last element on that, I think we just have to reflect the technical challenges and the technical difficulties, particularly for connectivity, be it broadband or communication, telephones, and I know at times that can be a challenge in the rural areas.